537 million people are living with diabetes in the world, and this number has been predicted to rise to 643 million by year 2030 and to 783 million by year 2045. Out of these 537 million people living with diabetes, about 240 million people are undiagnosed. In Africa, for example, about 54% of people living with diabetes are undiagnosed. And even in a well-developed continent such as Europe, about 36% of people living with diabetes are undiagnosed. This statistics is according to the International Diabetes Federation. This statistics leaves us with a concern. If 240 million people are living with diabetes undiagnosed, what does this mean? How do we curb this? How do we reduce the number of people that have been predicted to have diabetes in the next 5 to 20 years? This is the purpose of this video, so please keep watching. Let everyone get tested. Let everyone get to do the HbA1c test. The HbA1c test. What is the HbA1c test? HbA1c test, also known as the glycated hemoglobin test, measures the level of blood glucose over the past 2 to 3 months. Now, this is the mechanism of this test. We all have red blood cells, and every red blood cell usually contains a component known as the hemoglobin. This hemoglobin is known to be the oxygen carrying content of the red blood cell, but it also performs another function. It binds to every free moving glucose in the blood. And so any glucose moving in the blood binds with the hemoglobin in the red blood cell. And because the red blood cell have a lifespan of about 120 days, this hemoglobin that has been coated, that has binded to glucose, remains in the blood for this long, for about 120 days. So when an individual gets the HbA1c test done, which measures the number of hemoglobin that has been coated by glucose, this test is able to measure it for the past 2 to 3 months, which is according to the lifespan of the red blood cell. And so what the HbA1c test does in essence is to measure the blood glucose level of an individual over the past 2 to 3 months. This makes this test very reliable, very accurate, and very difficult to manipulate. Who should get this test done? Who should get tested? If you are 45 years old and above, you need to get this test done. If you are 45 years and above, you need to get this test done. If you are not up to 45 years, but you are overweight, or you are obese, or you have other risk factors of diabetes, you need to get this test done. Some other risk factors include if you have a family history of somebody who has diabetes, maybe somebody in your family has diabetes, your dad, your mom, your grandpa, your aunt, then that means you are also at risk of developing diabetes, and you need to get tested so that you can know how to nip it in the bud. If you are physically active for less than 3 times in a week, you also need to get the HbA1c test done. Now, if you are a woman and you develop gestational diabetes during your childbearing period, you also need to get this test done, because you developing gestational diabetes has put you at risk of developing diabetes later on in life. So you need to get the HbA1c test done. If you had a heart disease or stroke in the past, you also need to get the HbA1c test done. What preparations should an individual make before having the HbA1c test done?